In this video, we'll discuss epidemiology and risk factor of delirium. So what are the two most important risk factors causing delirium? Two most consistently identified risk factors are old age and baseline cognitive dysfunction. I have divided this topic into three. Number one, in-hospital risk factors. Number two, medication, alcohol, and illicit drugs. And number three, metabolic, endocrine deficiency, and other disorders. So in-hospital risk factors for delirium. Unfamiliar environment of hospital increases the chances of delirium. 50% of the people over the age of 65 with lowest scores on cognition tests develop delirium on hospital admission. So 50% over the age of 65 develop delirium in hospital admission if they have a low score. So what percentage of hospitalized and ICU patients develop delirium? 15 to 55% of hospitalized patients and 70 to 85% of ICU patients develop delirium. What's in-hospital mortality rate from delirium? In-hospital mortality in delirious patient is 25 to 33%. This mortality is equal to the mortalities caused by sepsis. Patients with in-hospital delirium have high mortality in the following months and years. The other conditions that may cause delirium are bladder catheterization, physical restraints, sleep and sensory deprivation, addition of 3 or more drugs, and surgery and anesthesia. Dementia is a major risk factor for delirium. At least 2/3 of cases of delirium occur in patients with coexisting underlying dementia, and in acute setting, it's difficult to differentiate between dementia and delirium. In elderly, delirium is common in systemic infections and CNS vasculitis. What about the nursing home? 2/3 of patients in nursing home develop delirium, and deliriums are very common in palliative setting. Next topic, medication, alcohol, and illicit drugs. Nearly 1/3 of all cases of delirium are due to medications, especially in elderly. So 1/3 of cases of delirium due to medications and addition of 3 or more drugs. OTC, herbal, and prescribed medications are precipitating causes of delirium. Anticholinergics, narcotics, and benzodiazepines are frequent offenders. Usually, anticholinergics don't cause delirium in young patients, but very high dose of anticholinergics can cause delirium in young patients. Both alcohol intoxication and alcohol withdrawal can cause delirium, but alcohol withdrawal causes classical hyperactive delirium. And which drug causes hypoactive delirium? Opioid intoxication causes hypoactive delirium, and this may be unrecognized and is associated with worse outcome. Illicit drugs. In young patients, illicit drugs and toxins are common causes of delirium, like club drugs, PCP, ketamine, MDMA, ecstasy, and GHB. Which deficiency disorder causes delirium? B1 thiamine, folic acid, and B12 cyanocobalamin deficiency cause delirium. Which endocrine disorder causes? Thyroid and adrenal disorders cause delirium. So TSH and adrenal function tests should be done. Hepatic and renal failure, hypoxia, hypercarbia, and autoimmune disorder cause delirium. Electrolyte imbalance, sodium, calcium, magnesium, or glucose can cause delirium. If a healthy individual with no known history of cognitive illness on hospitalization or elective surgery suffers delirium, then an unrecognized underlying neurologic illness such as neurodegenerative disease, multiple previous strokes, diffuse cerebral cause should be considered. Focal lesions like focal ischemic stroke or mass lesions rarely cause delirium, and CNS infection, meningitis, encephalitis, and abscess like focal lesions are less common etiologies of delirium.